HAIs are healthcare-acquired infections. The CDC says that 1 out of every 31 patients during a hospital stay will acquire an infection. Many of these will be a surgical site infection. While non-sterile instruments are not the leading cause, they certainly are a contributing factor.
Nowadays, medical devices are becoming more complex, smaller, which is excellent for patient care, but tend to have more crevices, more spots for potential contamination.
Cleaning a device is just as important as sterilizing the device. You have to remove the bioburden like dried blood in order for the device to be properly sterilized.
Patients with SSIs are twice as likely to die, 60% more likely to be admitted to the intensive care unit, and more than 5 times more likely to be readmitted to the hospital after discharge.
There's many international and American standards that are used by medical device manufacturers and also validated by testing laboratories. This testing is used by the FDA to help clear Class II medical devices before they can be legally marketed in the U.S.
Standardized cleaning and sterilization cycles could aid in reproducibility of reprocessing reusable medical devices.
Reprocessing personnel are often asked to turn around instruments in unrealistic timeframes. Departments that have limited resources may end up taking shortcuts. So it's critical that these departments have the appropriate resources, especially time, so that they can follow the written instructions for use.
The mission of ISHM is to promote patient safety worldwide by raising the level of expertise and professionalism for central service professionals. Currently, there are 4 states in the United States which require central service technicians to be certified: New York, Connecticut, Tennessee, and New Jersey. Right now, we are working on other states.
Ensuring instructions for use, IFUs are practical for real-world settings, can be challenging. Device manufacturers often rely on the expertise of validation laboratories to aid in developing more realistic reprocessing steps.
Validation labs are an insurance policy for the medical device manufacturer. We assist manufacturers during the design and validation phases to develop IFUs that are practical and reproducible. Following a validated IFU produces a safer patient instrument and reduces the chance of shortcuts at the healthcare facility.
Standardized cleaning and sterilization cycles could aid in reproducibility of reprocessing reusable medical devices.
Validation labs like ours work with AAMI and ANSI organizations to help improve and adapt standards. As part of over 25 working committees, we work with other key opinion leaders in the industry to help drive change.
The answer is almost always the same: education. More education for the medical device manufacturer when they're doing product development, the sales rep when he's selling the device, as well as the technician who is using the device. In fact, it's recommended that the technicians become certified so that we can document that they have the necessary training and education to properly reprocess each device.
As a surgeon, we're always concentrating on the next task at hand, so we really rely on our staff, our instruments, our implants, that they underwent the appropriate sterilization, not to compromise our patient care.
Highpower validation testing and lab services has been validating and testing reusable medical devices for over 30 years.
Highpower is not only an ISO 17025 accredited validation laboratory, but we also have previous experience as a Class II medical device manufacturer and a sterilization contract lab. We have 6 different service programs available to our clients. We have an excellent working relationship with the FDA, and they're very familiar with our protocols and our test methods. We not only validate medical instruments, but we validate the sterilizers themselves.
Highpower is evolving to meet the changing needs of the medical device industry.
Just as every medical device is different, so are the needs of our clients. We work closely with each of them throughout the process to provide services before, during, and after testing. Most manufacturers think of us as an extension of their team. At the end of the day, we provide safe and effective medical devices, which ultimately provide patient safety.
Patients pick the best surgeon and the best hospital, but central service technicians are the ones responsible for cleaning and sterilizing surgical instruments. They are the first line of defense to prevent patient infections.
To find out more about Highpower validation testing and lab services, go to highpowervtls.com.